A CDC advisory committee is going to meet to discuss cases of heart inflammation seen in a small portion of people who have been vaccinated and received that COVID vaccine. The CDC claims that there have been more than 300 confirmed cases. It's new at 11. CBS 17's Maggie Newland is digging deeper into this. Maggie, you had a chance to talk to some folks. You learned a few of those cases right here from the Triangle.
That's right, Rod. The CDC and doctors emphasize that these conditions are extremely rare following vaccination, but both UNC and Duke have seen potential cases. The CDC is set to discuss reports of more than 300 cases of heart inflammation in people who've received a COVID shot.
Myocarditis is an inflammation around the heart that we've known occurs with lots of different things, toxins, infections. We've seen myocarditis after influenza.
Doctors have also seen it in COVID patients and in rare cases following the shot. Duke's chief of cardiology, Dr. Manesh Patel, says the hospital's seen a handful of potential cases in vaccine recipients.
Probably 4 to 5 is what we've heard. Put that into perspective, at one point we had several hundred people that had COVID in our area in the hospital. Of that, many people with myocardial or heart dysfunction from the infection itself.
Of the potentially vaccine-related cases at Duke, he says most people did not have symptoms. Rather, doctors noticed inflammation while doing tests for other reasons. But some people do have symptoms.
Chest pain, shortness of breath, palpitations, like feeling like your heart's fluttering, dizziness.
Dr. ZACHARY WILLIS, a pediatric infectious disease specialist at UNC, recommends vaccine recipients and their parents be aware of any potential symptoms and get medical attention if they have them.
Patients have responded quite promptly to common anti-inflammatory medicines.
Both doctors emphasize that the condition following vaccination is extremely rare. More than 177 million people in the U.S. have received a vaccine.
I continue to recommend it for, for any patient who is eligible to receive it.
Your fear should not be the vaccine as much as your fear should be getting COVID.
And at this point, no definitive link has been established between the vaccine and these cases of heart inflammation. But Dr. Patel says he wouldn't be surprised if there is a link in a small number of cases. Doctors do expect to learn a lot more during that CDC advisory committee meeting tomorrow. We're live in Raleigh. Maggie Newland, CBS 17 News.
All right, Maggie, thank you.